hesitate to even bring them up because they're so debated in the scientific community. But in general, dominance just refers to a preferred laterality. For example, if you are right-handed, then you are left motor dominant, right? If you look at the clock there, for example, hold your index finger and put it in line with the clock, and then alternately close your right and left eye. It should only line up with one of your eyes. If it lines up with your right eye, then you are considered to have right ocular dominance. But my point is, even though you're right-handed, you won't necessarily have right ocular dominance, right? And that's for a variety of reasons. So laterality just refers to this division of labor amongst various faculties. And we'll talk about some of the anatomical reasons for that a little later. I just want you to be familiar with the term. So in general, let's just sort of, and we're going to look at a little video in just a second, but let's just sort of summarize it this way. In general, if you're right, and I'm going to have to simplify our discussion, so I'm going to make the assumption that we are talking about right-handed individuals, and I guess that gives me, you can accuse me of being handed, what's the, handist, yes. Not sexist, but handist. So lingual function is predominantly in the left brain. And this is important because if you have a patient with a left side stroke, it's more likely then to affect their ability to speak or to understand language, and that we talked about before. On the other hand, if the stroke, and this is the video we'll look at in just a moment, if the lesion, trauma, or stroke occurs on the right side, a different set of abilities are likely to be involved. And these usually include object recognition. Object recognition, the ability to recognize, discern, and identify objects. Oliver Sacks wrote a book about the man who mistook his wife for a hat. Yeah. You'll read of patients who wake up in the morning screaming that somebody is trying to strangle them, and it's not somebody that's trying to strangle them. What is it? It's one of their arms against the throat. The inability to recognize objects includes something called prosopagnosia, the inability to recognize faces. So it's just a very general deficiency that, for the most, in all cases, for the most part, resides in the right hemisphere in left brain individuals. Now, sometimes it's problematic, but I've listed some terms here on the right-hand side that I just want you to be able to define based on this fellow's discussion.
Right hemisphere stroke
I'm going to turn the volume up here.
may also experience left-sided neglect. Right hemispheric stroke survivors may also experience left-sided neglect, causing them to ignore objects on their left. For example, a person with this condition might not eat food on the left side of the plate. Conversely,
All right. So when he talks about left-sided neglect here, he said that this is a right lateralized stroke. And they might not eat a thing from this plate. Why? Because they don't see what's over there. Oftentimes these patients, if you ask them to draw a clock face, you only see 6 numbers on one side. Now, there are some remarkable therapies that are intended to address this now, cognitive behavioral therapies, but short of just drilling, it's very hard to force somebody to acknowledge something they don't perceive. So that is left side neglect.
might not eat food on the left, for example, this plate. Conversely, a stroke in the left hemisphere of the brain can cause paralysis in the right side of the body, or right hemiplegia.
So hemiplegia just refers to usually, depending upon the location of the stroke, impaired motor function on the opposite side that's affected by the stroke. Because remember the decussation.
survivors of left hemispheric strokes may develop aphasia, a term used to describe difficulty with speaking or understanding language. Patients who've had a left hemispheric stroke.
So the question I do have, I forgot that I had aphasia. So aphasia, again, later on you'll learn many different types of aphasia, but it just implies impaired language ability, either interpreting, understanding language, or speaking language. And the term aphasia usually implies, what's the word I'm looking for, a neurological cause as opposed to a psychological cause. Aphasia generally implies neurobiological issues.
Language. Patients who've had a left hemispheric stroke often develop a slow, cautious style of behavior. They may need frequent instruction and biofeedback on the most basic of tasks. Both right and left hemispheric strokes can affect short-term memory.
Yeah, so as you will find out later, there's a wide variety of manifestations, but I just wanted you to be, we've already talked about stroke, but be familiar with these other terms. This is one of those diffusion tensor renderings of the white matter. Hopefully you can see, identify some of these pathways we've talked about. But what this is showing, intended to show you, is what's happening down here. So this was a stroke in the brainstem, and you can see how dramatically the brainstem white matter has been affected. I would be surprised if I would survive this. I can't imagine how that would be possible. If you want to play around with these images, you can look at the attribution of faculties of the right and left hemispheres. I'm not going to ask you about the putative division of labor, but in general, language on the left, object recognition on the right. Yeah.
When you talk about left side neglect, is there a right side neglect too, or is it just typically seen for the right hemisphere to neglect left side?
No, it's usually just if the stroke is on the right side, you get the left side neglect issue. If it's on the other side, again, aside from these other things we've mentioned regarding speech and so on, it's more a problem of motor function and, again, form field recognition. Individuals just lose the ability to recognize entire aspects of their sensorium. It's somewhat analogous to acallosal patients, acquired acallosal patients. I'm just reminding you of the mesolimbic dopamine reward pathway and its importance. It's going to be very important in your field. You're going to have, how many times a day do you read about a drug bust somewhere? It's all usually a drug involving, well, it's an opiate or a pain medication or something like that. Opiates target this pathway, dopaminergic drugs target this pathway. And aside from that, this is the fundamental, if the patient presents an issue of motivation, motivation, as we saw in the case of the Parkinson patient, even ability to get up from where they're sitting at the later stages of the disease, it's going to involve this fundamental, and it goes by a variety of names. We talked about the VTA nucleus accumbens pathway, but we'll just call it the mesolimbic dopaminergic reward system. And one of the important, really only two who we've concerned ourselves with, two important dopaminergic pathways. This fellow is Mr. Ponzi. You ever heard of Mr. Ponzi?
Yep.
Yeah, does he look like he has a trustworthy face? Wouldn't you trust a face like that? But, of course, another issue that we all have to deal with is that as we age, for whatever reason, we become less astute in a variety of ways. We become less able to discern, let's say, facial cues. How many times have you heard about an elderly person being taken advantage of by a phone scam or a door-to-door scam? And in part, it stems from our diminishing ability to differentiate and discriminate normal facial cues. That fellow looks great to me. I'd like to buy a used car from him right now. Whereas you probably see a little deviousness there. You see a little Hannibal in there. Hannibal, I'm talking about Ackland video because most students call him Hannibal. He looks a little devious sometimes. Right? But it's attributable to that region just inside the temporal lobe. We talked about it, reflect the temporal lobe. Right in there is a little region called the insula, very near the amygdala, very near. Why I put it here? Very near the limbic system. And this is just something to think about, that you're thinking about the nature of our mortality. This is a little snippet about Tatiana and Krista, and you can see they basically share one brain. And so they share their sensorium. For example, one can pick up an object and out of her field of view while the other one looks at the object. They share thoughts. There will be no speech, no communication, but one will just pipe up and say, "Stop that," and she'll smack her sister because she heard the thought. I have that ability, you know. I know what you're thinking. All right. So again, just a very simple representation of the cerebral hemispheres. All right, in the time remaining, let's talk a little bit about the autonomic nervous system. All right, so we know that the ANS is this centralized neural network specialized for maintaining homeostasis, maintaining, regulating heart rate, respiratory rate, maintaining hormone levels to some extent, at least in association with the endocrine system, regulating GI tract motility and secretion. So it performs a number of functions. And of course, when we talk about the central regulating region of the autonomic nervous system, we sort of say it's diffusely arrayed around the hypothalamus and the brainstem. They seem to work very closely together, depending upon the specific process or autonomic reflex involved, to carry out the business of autonomic regulation. Having said that, and I've used this example on several occasions, you know, effervescence or blushing. You would agree that if I tell you to increase the blood flow in your face right now, you probably couldn't do it voluntarily. But if I say something that will make you quite angry or embarrass you, it nevertheless, the face will redden, that was a cognitive response. So my point being, autonomic responses can have a cognitive origin as well, even if in many cases you don't have rational or deliberative control over those responses. The two divisions of the ANS are the sympathetic and the parasympathetic, and you sort of see in this illustration down here, which always gives students spit up. I have to put that out. It's a seesaw. You ever played a seesaw when you were a child? The idea is when one is going up, when the sympathetic or the parasympathetic is elevated, the other one goes down. So they're sort of reciprocally regulating many systems. In fact, most systems in the body that are involved in autonomic regulation have both sympathetic and parasympathetic nerves extending to them. And you can see some examples there, the vasomotor tone, GI tract motility, secretion, urinary continence. For example, if you get very afraid, why do you pee in your pants? Let you reflect upon that. And perspiration, cardiopulmonary and endocrine system. So all of these have autonomic components. And we say, again, that this autonomic regulation contributes to overall salubrious or salutary homeostasis. It's the normal, it enables you to respond normally and appropriately to the surrounding circumstances. And oftentimes it's rather rapid, and oftentimes the innervation can occur within seconds. Ideally, under normal circumstances, the parasympathetic nervous system dominates over the sympathetic. We call that parasympathetic tone, and we used the term tone before, or tonus, tone or tonus. And we indicated that in physiology, the term tone or tonus implies mild persistent activation. So once again, parasympathetic tone normally predominates over sympathetic tone. When that ceases to be true, the person probably exhibits some type of pathology. Everything from an endocrine disorder to some other symptom. We've talked about how many of you, we looked at the brown fat revolution, and I hope all of you enjoyed that or have joined that movement, but how many ads have you seen for stress-induced fat? Have you familiar with the fact that stress can make you fat? Yeah, exactly. Well, that's the theory behind it. I'm not sure that I accept all the premises of either that or the brown fat revolution, but that's the theory behind it. So normally, parasympathetic tone should be predominant. But the sympathetic system provides a mechanism for you to better adapt to stressful situations, either intrinsic stress, such as a fever, such as some type of infection or illness, or extrinsic stress, such as when you're running up the staircase so that you're not late for class. Your heart rate and respiratory rate change to accommodate the increased exertion. The mnemonic for sympathetic activation is fight, fright, or flight. And of course, you've heard that so many times. What is the mnemonic for the parasympathetic? Rest and digest. So that sort of sets the tone for the two. We also pointed out, again, just reviewing some points we already made, that the sympathetic nervous system cheats and when it is activated. How does it cheat? Remember I made that point earlier? I was making this kind of a silly statement. No, that's a different concept. It cheats in that it's hooked up with the endocrine system. So that during sympathetic activation, your sympathetic nervous system induces dramatic release of adrenaline into the blood from the adrenal nebula. The adrenal gland is pumping. But did you know that you actually have something of an adrenal gland in your brain as well? I bet if I gave you 15 or 20 seconds to think about it, you could tell me what that region of the brain is that acts a bit like the adrenal gland in your abdomen. You know the region of the brain that is associated with. No, that's a good guess. But what region of the brain is identified with adrenaline and adrenaline? No. We've mentioned it. You should know it. No. No, I'm getting more depressed here. I'm seeing killing me here. Excellent. Thank you. The locus coeruleus. And that region, actually, what we found out in recent years is it's actually secreting. I don't know what the proper term is, but I guess secretion is the proper term. It's releasing copious amounts of chiefly norepinephrine into the surroundings with sympathetic activation, just as the adrenal nebula is releasing adrenaline into the blood.
Does the rostrum and the eye have that?
Again, possibly. I've never encountered that in my reading, but it's possible. Normally what you see is about the I can't even say it now. Coeruleus effect. After an hour and a half, I'm pretty much gone. So by contrast, parasympathetic activation tends to be much more focused. So in parasympathetic activation, it's usually a single tissue or single system that's affected. Not so much the case for sympathetic activation. Sympathetic is more all or nothing. All right, so let's talk a little bit about the anatomy. I want to try to allay some of your fears regarding the anatomy test. Remember, you do not need to know this level of detail for the anatomy discussion of the autonomic nervous system. All right. Anatomically, the ANS, we've indicated, unlike the somatic and the sensory systems, includes two neurons between the cord and the effector. Two neurons between the cord and the effector. In most cases, we'll see a couple of exceptions we'll talk about in a moment. And those two neurons connect, they speak to each other at an autonomic synapse. All right? So the two neurons in an autonomic pathway are a pre-ganglionic neuron and a post-ganglionic neuron. So do autonomic ganglia have synapses? Yes. Do sensory ganglia have synapses?
No.
For the most part, no. Correct. And we're looking in this illustration at a sort of stereotypical anatomic pathway, autonomic pathway. Here's our ganglion. The blue is the preganglionic fiber, and then this is the post over here. This is going to be the spinal cord here, and then this is going to be our effector tissue on the far right there.
Can you repeat that one more time?
Yes, the general model, there are going to be a few exceptions, but the general model in all of these autonomic circuits, especially sympathetic, will be much more evident, is that there are two neurons in the pathway between the cord and the effector, two neurons. They hook up at an autonomic ganglion, so that being the case, the first one is called the preganglionic neuron, and the one that's distal to the ganglion is called the postganglionic neuron. And then this is the spinal cord, and this will be the effector. This could be the GI tract muscle, this could be a smooth muscle in a blood vessel, it could be any number of things. It could be a rectopili muscle in the skin. The last thing I would mention in a very general sense about the organization is that, again, especially the sympathetic, but it's true across the board, the ANS exhibits divergence. So what do we mean by structural divergence?
Right.
Yeah, one to many, exactly right, one to many. So all of our discussions are going to be somewhat simplified for that reason. Just remember that the ANS in general is fairly divergent in organization. And this is just to remind you, because I just want to make sure that we don't confuse these various pathways. So we know the spinal cord here. We can see the gray matter of the cord here. Let's look at this pathway right here. So let's begin with this one. What type of pathway is this? We'll call it A. It's a motor pathway with one neuron between the cord and the skeletal muscle. So this is, and you can see the nucleus of the motor neuron in the ventral horn there. This blue one up here, what type of pathway is that?
Sensory.
And the sensory neuron is characterized by what type of neuron, at least the somatic sensations? Yeah, unipolar or pseudo-unipolar with the neuronal cell body in the dorsal root ganglion. All right. Now compare that to this pathway. Instead of one neuron that we have in both the sensory and the motor pathways, just bear in mind different function, different organization. But two neurons here, preganglionic extending from the cord to the ganglion and postganglionic from the ganglion to the effector. Yeah.
Do most somatic pathways not have any neuron? I mean, they usually do, right?
Okay, so be careful here. The problem with your question is you used the word somatic. So how do we define somatic? Because I'd used the term the same way I should have earlier. How'd you explain somatic to a fifth grader?
And you're consciously
All right. So that's one definition of somatic, and that's the way that you and I just used it a moment ago. I shouldn't have done that. Well, can the term somatic refer to sensation? Are there somatic sensations? All right. And what are somatic sensations?
Temperature, vibration.
Yeah, corporeal, vibration. So I just want you to be aware. I think what you really mean then is motor pathways, right? Is that what you mean?
Yes, right.
Okay. And the answer to, again, this is the motor pathway. This is, at least is the lower motor pathway. What happens in here is so complicated. There's so many possibilities. So there's no really way of saying there may or may not be an interneuron, because that implies the presence of a sensory. The motor pathway, strictly speaking, is just the neuron coming down to this and the neuron going up.
Can we refer to the one on the right, like the kind of like a voluntary motor pathway? Like this one would be
Yeah. Yeah, that would be, again, the way that I were using somatic, but I just want to alert you to the fact that that's fine with me, but as long as you understand the complexity of the term.
And like the sensory of the autonomic, it's not like, say you burn your finger, like you get like a fight or flight response from that, or is it like, oh, I'm in a scary situation? That's what the sensory.
All right, so Trenton is asking a question that I absolutely forbid about, we used this term before. You remember what we call autonomic afferents? What's the term we used to describe them? Visceral afferents. Yeah, that's just a forbidden word. This is something of which we will not speak. No, I'm joking. The problem with the autonomic afferents is that, okay, so use the example of mattress of burning. All right, so that's not autonomic at all. If you're aware of the sensation, then that's not an autonomic. So that's a somatic sensation. There are visceral afferents, but let's talk about those later as they come up. I just sort of that's going to be a sticky wicket.
Is what kind of he's getting at the autonomic, the thing you talk about, like a bird smacking the window and your head reacting before you even know?
No, that too is a sensory response. Because what's happening there is, although you're not aware of it, your eye is seeing something, or maybe your ears, and you're responding to it. It's just you're not aware of that until a moment later. An autonomic response, an autonomic afferent has two. I wish you had one. It has two general classes. Number one, autonomic afferents are carrying information from your entire body back to your brain about your temperature, about how much you're sweating, about how whether your vasomotor tone is whether your smooth muscle is constricted or not. That's one type of autonomic afferent. The other, and it's a little more cosmic, again, is the abdominopelvic sensation. Patient comes to you and says, I've got a diffuse localized, I've got a diffuse pain, I feel pain here. And you ask them some more questions, but I guess I would ask you, if they have a pain here, does that mean that there's a problem, that there is an intestinal blockage or a lesion or something right there? No, it could be back here. So autonomic sensations of that type are more problematic. So let's, as I say, let's defer that until we have more information at our disposal. Yes.
Going back to the autonomic motor pathway, is the cell body in the lateral horn for that pathway, or can it come out the ventral horn as well?
All right, so the question was about the autonomic motor pathway. So when you talk about I think you mentioned the lateral horn or the intermediate lateral horn. Anytime you talk about that, you're only talking about the sympathetic. So you're automatically only talking about sympathetic function. And if it's an autonomic efferent, yes, in here we will make the assumption that that is true. Although there are a couple exceptions later, I think that's a safe generalization. Again, just setting the ground. I want to make sure we understand all the relationship between all these things. So here's the gray matter of the cord. We can see the butterfly up there. So let's talk about it. Rob mentioned an autonomic efferent. So somebody help me out here. Show me, tell me, you can even come up to the front of the class and use a pointer if you wish. But can you take me through the anatomical structures that would be utilized by an autonomic efferent? First of all, would an autonomic efferent, you indicated that the cell body would be up here somewhere, right? All right, which way is it going to go? Is it going to go toward the S or of spinal, or is it going to go somewhere? All right, you're going to go this way, right?
Yes.
All right, and then what? All right, into the ventral rootlets.
Into the spinal nerve.
All right, so we're going to go into the ventral root. Let's not forget all these parts. And you're going to go into the spinal nerve. Again, we're only talking about a sympathetic efferent because that's where these would start. Then what?
Into the anterior radius.
All right, we have a branch here. Which one are you going to go? This one or this one?
Left.
All right, you're going to take on the left. All right. So we're going to continue here. Do I keep going?
No.
All right, so I've got to back up here. All right, so I'm going to come out. Now what do I do?
Go left into the
All
ganglion.
right, so what I want to point out here is, this is our sympathetic chain ganglion here.
Yep.
So I somehow have to get from here to here, and these are the connectors that do that. All right. So that's the sympathetic, that's the preganglionic sympathetic axon that's doing all that.
then that little vertical piece is the piece that just extends straight up, all like throughout the breast.
This one you mean?
Yeah.
Yeah, that's the sympathetic chain. That's the paravertebral ganglion, sympathetic trunk. And so we're going to talk about this later, but these are also called rami. So we have these rami, and we have these rami to contend with. But I just want you to see that there must be some connector between all these other structures we've talked about, this peripheral nerve and that sympathetic chain. You have this slide, right? So we're not going to do it in here, but why don't you make sure all of you can recognize and identify each of the structures, and if you have any questions, maybe next time we can go over this, but I don't want to take the time to do this. But you should be able to recognize and identify each of those numbers at this point. Rather, I just want to try to get into this as far as we can. All right. So these are some general rules I just recommend that you commit to memory. And remember, we pointed out that the sympathetic nervous system is the thoracolumbar. Just keep that straight. That's going to help you a lot. Parasympathetic is craniosacral. That's the first rule up here regarding pathways. All right. Regarding the ganglia, sympathetic ganglia are generally present in two locations. The sympathetic chain or along the aorta. All right, we talked about three vertebral ganglia. So we have paravertebral and prevertebral. Those are the two primary locations for the sympathetic ganglia. Parasympathetic ganglia, a little trickier. Basically, we will argue that parasympathetic ganglia lie at the tissue of innervation. So they're way on down adjacent to the tissue of innervation by the target tissue. And so if that's true, then under most circumstances, sympathetic preganglionics are shorter than parasympathetic preganglionics, right? Because sympathetic fibers, sympathetic preganglionic fibers go to a ganglion, and then there's a long postganglionic. Not true for parasympathetic. The parasympathetic preganglionic usually goes all the way to the target tissue, and then there's some silly little postganglionic that cleans things up. So parasympathetic preganglionics are long. This is the simple way to summarize that. Yeah.
Can you say that is another way to say the same thing? The parasympathetic efferents are longer?
Yeah, that's fine. I just sort of want you to get in the habit of thinking about preganglionics and postganglionics, because that's the terminology I will use. There's a tendency for us to say presynaptic and postsynaptic, but I hope you appreciate that's a more general term. Right.
Just to clarify, because I don't know if I heard it wrong, the parasympathetic preganglionic are longer.
Long.
Yeah, okay. Good. Thank you.
So I've given you a bunch of pictures here. You've got what? So 1, 2, 3. And as you look at this, let's start with this one. For example, on the left is the sympathetic nervous system. On the right is the parasympathetic. So the left is the thoracolumbar. The right is the craniosacral. So use that as your point of orientation initially. We know that the parasympathetic involves specific cranial nerves, at least the cranial portion does. We've already talked about those. We'll talk about that in the anatomy class tomorrow in more detail. And then this is the sacral portion of the parasympathetic nervous system, which is predominant, for the most part, the pelvic splanchnic nerve. Right? That's the pelvic splanchnic, which forms most of the sacral portion of the parasympathetic. Sympathetic is trickier, so we're going to focus mostly on understanding the anatomy of the sympathetic. The parasympathetic, again, is comparatively easy to understand. And as I say, you have several pictures here. We'll come back to those, but I would rather, again, set forth a few general rules, and then we can hopefully look at those pictures with a little more sophistication. Before we do that, what we're looking at here And this is just showing you some of the tissues that are innervated. But before we do that, we talk about autonomic activation or autonomic innervation. Here we're looking at the way that an autonomic fiber would innervate smooth muscle. So this puts literally some meat on our discussion. This is a very large magnification of an autonomic fiber. And you remember in our synapse, in our discussion of the neuronal synapse, there was a presynaptic neuron and a postsynaptic neuron. This whole thing is the presynaptic neuron, right? And the yellow things are the neurotransmitter. And so what it's going to do, you can see as you come down here, these are the little threads or beads. It's this thing, this whole thread is going to release neurotransmitter in each one of those little bulbs. Those are called varicosities. And we'll see some variations on this later. But in general, what's happening is this smooth muscle is going to receive some neurotransmitter from that varicosity and contract in response. And just the amount of neurotransmitter will determine the degree of contraction.
Did you say, I thought I heard you say that's the preganglionic.
I used, this is the, I'm sorry, this would be postganglionic. You're exactly right. Postganglionic. But in any case, the postganglionic is going to be releasing the neurotransmitter. Exactly right. Postganglionic at the target tissue. This would be an example, for example, this would be an example of sympathetic regulation of vasomotor tone. The neurotransmitter in this case would be adrenaline or noradrenaline. And once again, the smooth muscle cells will contract in response to the amount of neurotransmitter present. But this looks nothing, the point I'm making, this looks nothing like the synapse that we described before. And it looks nothing like the neuromuscular synapse. All right, as I said, we want to focus on the sympathetic because it's a little more taxing. And the sympathetic nervous system consists of two general classes of ganglia that we've talked about, paravertebral, which you see simplified here, right, running along that little chain there. And then it consists of three of these, well, usually we say there are three of these prevertebral ganglia. And I'm sure it's in there somewhere. The prevertebral ganglia are also called collateral ganglia. Prevertebral is the same as collateral in the same way that paravertebral is the same as chain or trunk. We said there are three prevertebral ganglia that you need to be familiar with. And you'll see variant terms. This is fine. It's usually celiac, superior mesenteric, and inferior mesenteric. The inferior mesenteric and the hypogastric would be equivalent in this terminology. And so once again, if we're talking about a preganglionic efferent, it's going to come out the ventral side, pass through the ventral rootlets, the ventral root, enter the spinal nerve, and then in order to get to the sympathetic chain, it has to pass through these two, or one of these structures here. These are called the rami communicans or rami communicantes. I'm sure that's in there somewhere.
Now, is there one that goes before the other?
Yes, I'm going to get to that in just a second. Rami communicans, or sometimes you'll see rami communicantes. Sorry. I cannot spell and write at the same time. So you're exactly right. There are two of these rami, these two connectors that connect the peripheral nerve to the sympathetic chain ganglia. White and gray, white and gray. In our illustration, keep things sort of consistent and clear, the white is going to be on the outside. The white's going to be lateral. Of course, anatomically, that's not quite true, but purposes of representation. And the reason we're going to make that simplification is because I want you to understand that the preganglionic, sympathetic preganglionic efferent always sympathetic trunk by means of the white ramus, the one on the outside, the white ramus. Yes, the sympathetic preganglionic efferent leaves the peripheral nerve or the ventral ramus, whichever you want to use, to enter the sympathetic trunk by means of the white ramus. And we're just going to say it's the one that's lateral or on the outside. So if you're drawing this picture now, we can add a little more detail. It's going to come out here. It's going to skip the first one and come into this one. All right. So hopefully these next 4 slides, or next 2 slides will answer most of your questions about these pathways. And we're going to, as I say, just sort of adduce a couple of very, very simple basic rules here with respect to how these sympathetic pathways fall out. And our first rule will be the following. For structures above the diaphragm, for structures innervated by the sympathetic nervous system that reside above the diaphragm, the preganglionic neuron will synapse in the chain ganglion. For structures below the diaphragm, the preganglionic neuron synapses in the prevertebral ganglia. And as I said, we're going to get a few exceptions here, but let's sort of follow this out. So let's say we're, thought I'd have a better picture here. Let's say we really don't have a good picture, but we'll just pick, because the heart really doesn't follow our battle plan. But if you look over here look over here, so here's the preganglionic, it's following, it's going out the white ramus, and then there's immediately a synapse right here. Okay, everybody see that? Alternatively, this one over here could come through, and it could come through the white ramus and then go down and synapse. Or over here, you see it goes up and synapse. But in all those cases, what does the preganglionic do that's innervating tissues above the diaphragm? Synapse in the chain ganglion. All right. And for example, the pathway that goes to the eye we talked about. It's going to go way up. It's going to go all the way up to the superior cervical ganglion, but that's part of the chain ganglion, and then the postganglion is going to shoot off to the eye. All right. As I say, there are a couple of exceptions here. For one, this pathway to the heart, sometimes called the cardiac splanchnic or the cardiopulmonary splanchnic. So let's look at this one. This one passes through, goes into the peripheral nerve, goes into the white ramus, goes way up, actually goes up to the cervical ganglia. But to this point, it still obeys our rule. It synapses in the chain ganglion. The trouble is, and let's go back to the other side here. So let's look at the one up here on this side. You can see the solid line is the preganglionic, the dotted line, the dashed line is the postganglionic. So once the synapse has occurred in the chain ganglion, what does the postganglionic sympathetic axon do to enter when it goes back to the peripheral nerve? It leaves by the gray ramus here. So I guess one way of saying this, for all tissues above the diaphragm, not including the heart, when the postganglionic process leaves the sympathetic chain ganglion, it re-enters the peripheral nerve by means of the gray ramus. And so what does it do there? Well, it could go off to a smooth muscle in a blood vessel. It could go off to the skin to for the erector pili muscle. It could do any number of things. Now let's look at the heart very quickly. Here's the preganglionic for the heart. Does it re-enter via the rami? No. What it does is it has its own little dedicated pathway here, once again called the cardiac or the cardiopulmonary splanchnic, that goes directly to the heart. Yes?
That all splanchnics do that? Don't use the gray to go back in?
No, no. Again, for now, just to understand that splanchnics are dedicated autonomic pathways to viscera. They don't always do this. They don't always work this way. We'll see some examples why just a moment. Actually, I don't have time today. But for now, I think what should be clear to you is if we're talking about the general organization of sympathetic efferents. Once again, if the tissue resides, with the exception of the heart, if the tissue resides above the diaphragm, there's a synapse in the paravertebral ganglion. The postganglionic neuron leaves, go back into the peripheral nerve via the gray ramus. If the tissue innervated is the heart, which is a significant tissue, it has its own dedicated postganglionic pathway, which we call the cardiac or the cardiopulmonary splanchnic. And what's the other rule? If the tissue resides below the diaphragm, where is the synapse? Right. And so very quickly, we won't take time now to get into this in detail, but what you'll notice is if it goes to the gut, it goes through the spot, it goes through the peripheral nerve, through the white ramus, and here's the key point. Is there any synapse in the paravertebral ganglion? No, there's no synapse in the ganglion. The preganglionic goes all the way to the prevertebral ganglion where the synapse occurs there, and then the postganglionic extends from the prevertebral ganglion to the target tissue.
Does that exit have a name?
What?
Like the gray rami communicans is where it normally goes, but for this one, the exit to the right.
Oh, you're asking what this is?
Yeah. Do they have a name?
George just asked about it. This point.
Oh, that's just.
Those are the thoracic splanchnics. And then the final exception is this one, the adrenal gland goes right to it. No, just one neuron smack dab straight to it. So this is sometimes called the adrenal splanchnic, but it goes. There's no postganglionic neuron in the adrenal gland. Yeah.
That's kind of what I was asking about. Is that it doesn't? That's another splanchnic that doesn't have to go back through the gray.
That part is true, but it has a different anatomy than the cardiac splanchnic. Yeah, you're exactly right. Okay, so we'll stop there. Yes.
So preganglionic here, it's also called collateral ganglion. It's just the second name for preganglionic. It's another way to confuse us.
Yep.
Perfect. Okay. Actually, I get this.
Oh, I'm popping and locking. Yeah. Yeah. All right. Don't you remember? God. I talked to you in lab. But we talked about not wanting to take your shirt off. That was after? No, it was during. Because I was going to start doing my blood pressure on you, and then the teachers came. Oh yeah, I have no memory. I remember that stuff. Are you guys serious?
spent like 45 minutes yesterday to figure it out. It's like 4 of us, and we did figure it out. That's why I actually understand it. But I'll explain it. You bring lunch?
I think I might go practice with my partner now really quick. So then after lab, I don't have to stay.
Well, I have to go out and eat, so that's why I was just asking. You wanted to go, or I didn't. You want to go? Do you need anything? Yeah, I didn't bring it this morning.
Oh, you're going to lunch?
I have to go out and get
Oh,
lunch.
got it.
You want anything?
I'm good. Thank you, though.
Anybody going to lunch?
Well, like, look at you. Oh, you can too? Yeah, you can. Yeah. I'll send you the, I'll like, yeah, send you the link. Oh, and then you can print yeah, and it has all your highlights. It will move the slide up. Yeah, I don't move it up, but like I don't have like not when I was writing it. So it's basically just like everything back that you did. Where are you writing it? Like try to write something. So she'll write it next to whatever it's related to. Before I was like writing really big on paper. How do you write that small? I don't. I use my style.
Yeah, so maybe this is like the first day that that's why I'm not really like computers or something like that. But like here, like I can always like highlight. I search whatever. Search whatever.
I'm still learning how, but Kayla's really good. But I know like I know how to get back where if you get that. Yeah, I use that too. I bought one and shot. That was way better.
Yeah, I recorded, so it's like helpful. Like here, like that.
Oh, see, mine's later, so like I think they're pretty cheap.
Huh? Sure, let's go. Let's do it. Let me know how it is. Where you guys going?
Oh, no.
You wanna go?
Oh, that's tempting, man. That's tempting. I'll probably go there for dinner.
You wanna go?
I'll go for dinner.
Okay.
Yeah, let me know how it is. Where you going?
Jamaican.
Well, yes, I can keep going there. Stupid.
How, is it good?
Yeah, it's good. Really good.
Really?
Yeah.
Wait, where?
And if you go there, you get like a student discount. So make sure you give some.
Oh, a student discount?
Yeah.
Yeah, all right.
It's not a big deal, but still something.
That's okay. It's a big deal.
Where are you talking about?
Are you guys leaving?
The Jamaican place. Okay. Yeah, I always bring food, but the day that I don't, I'm gonna go.
Yeah.
That's fine. You wanna eat downstairs? Yeah.
We're going to the Jamaican place. You know?
Oh, you are?
Yep.
Okay.
Do you need anything while I'm out?
I think I'm good.
Okay.
But thank you for asking.
Of course.
Okay, let's see what you say. So my understanding is the slight finger doesn't go through the greater ring of the spine. So it doesn't use the peripheral nerve it goes, this is the splanchnic, it goes boom, it goes directly to the visceral organ, visceral organ.
Yeah.
So that's post-ganglionic. You know, this is pre-ganglionic, post-ganglionic.
Did the stairs. Sarah, do you want to do it now or do you want to eat lunch and then do it later? Okay. Later. I have a phone call at 12:20.
Right, I understand
Okay,
the
then you just want to meet
post-ganglionic,
back here
when
like
they
one?
say,
Yeah, okay, that's
well,
okay.
that's pre or post-ganglionic.
No, I moved this in there. Are we
Why
not?
are
What
these
are you
all
doing?
free?
Come on.
That makes me think that it's
Yellow,
directly
as
from
you
this.
say.
Oh, she's getting me with the Arabic.
Sure.
Jeez. Like, all these things.
There's one post.
Wanting to know what is,
Right.
what does pre-representing mean, you know, in terms of Jesus.
Okay.
So you know they both have, they all have pre and post.
Yes?
You know what they do?
Okay.
Why is that one considered post-ganglionic?
Because it's got this maybe, that it has its own split, the cardio.
These all have those splints.
Sure.
Yeah, these are all splinted nerves. I know post-ganglionic refers to this.
That one is the only one that doesn't synapse in the pre-ganglion, it synapses in the cerebrospinal. But it would be like
Right
another,
here.
I think it would be another ganglion.
Okay, well, hold on, go to the next slide.
This one?
No,
On this?
Like for instance,
on this one.
for instance, the other ones, they would just, they don't synapse like that, they're just bypassing, they would have a same right here.
Yeah, I want to see the next slide because it's got a different situation going on a little bit. So maybe
Oh, here's a preganglion. Oh,
it,
no.
it goes straight, I think it goes straight to the organ. Yeah, without the synapse. You
So
see
it
that?
does come from the lateral.
You see that? So maybe the cardiac is the only one that actually synapses before it
So
gets
it's
to the heart.
literally is a preganglion.
Well, this is another
Close.
exception too.
These are pre,
That's
because they get to it with the pre. See?
This one doesn't synapse at all. It just has one.
Right, right, you're right. It doesn't synapse, it's one there and one back. Whereas the other one, it actually has a synapse, and so it has a pre and a post.
Well, they all have, that's the only exception to that.
Is the adrenal.
Yeah, all the rest have pre and post, regardless if they're,
What about here? Wait, okay, now go back to the other
This one?
lecture, the whole other lecture. Yeah, these are all free. So these, as I understand it, these go directly to the organ without a synapse. This has a synapse prior to the organ, that's
I
why
think
it's got
synapse
post.
is significant.
Yeah. They all do have to have a synapse.
The synapse is just in the pre-ganglion.
Okay, show me on, can you show me on the other one?
This one, maybe this one.
For instance, like this is what they all do, except
Right,
for the cardio one. They all go through there, bypass it, they go through it, they don't stop, then they synapse right there.
At,
And that's the pre-vertebral.
at the,
The heart is the only one that would synapse right here.
in the vertebra.
It still acts as like a splanchnic, then it goes through the splanchnic.
Right. So this is post-posterior right here. When they synapse in here. And a trunk, and a sympathetic chain ganglia. This is post.
Yes.
Why
The
is that?
pre
See, that's
all right here.
pre, post, or, and then, so what's this called here?
But this is
If it
pre.
goes out here.
This is pre, because it's going that way.
Well, this one is still a post because it synapses here, or this is the
Their origin,
beginning,
right.
and it doesn't synapse right there.
Right.
So this is still the second, you know, the
Still
only
the pre.
synapse.
Oh, okay, I see.
So this would be the pre rather
I
than
got
just stopping right here.
I got you. And the post
No.
is literally
I'm
another.
a little confused. Oh, okay, so it's coming there.
Yeah, this.
So it's,
So this one is not the post.
so you'd still call that a post. You're calling that a post?
It's pre.
You're calling that
I
a
call
pre?
that post. I'm calling this.
Oh, really?
That's how I've been thinking of it.
Oh, I'm talking
All
about.
the pre's, they, for, you know, the synthetic, their cell bodies are right here. So that's where the pre starts. And the wherever it synapses with the second one is, that's where the post starts. I don't remember when this is.
Ventura, Pet Detective
Parts of it.
with Jim Carrey?
Yeah.
Are you friends with Snowflake? Does he call you at home? Do you have a dorsal fin?
I know like
Dorsal.
I know
Dorsal
dorsal for
fin.
the back,
Yeah.
but I can't like when I'm looking at this, I'm like, well, which way is the motor coming out?
Okay. Oh yeah, because it doesn't have the spine on it.
Yeah, like if this wasn't labeled, I'd be like, well, which way is the front?
You know how
and back?
this is gonna sound really silly, but the way I remember it is like there's all these little bumps here, and
Is it
like yeah, and like with all these little bumps here, for some reason I see it as like it's more curvy, it's more sensory. I don't know. I don't know.
Oh yeah, we're gonna think sensory is closer to the border, is what he said to the top. Right?
Yeah, that's true. Sensory.
The butterfly wing actually touches the border almost, whereas the motor part of the
Like
butterfly
if you
wing
want to
doesn't.
flip the butterfly upside down.
Right.
Sorry for my bad acting. I was hoping that would help. Taking your mind. I just started here. It's a pre and post. So maybe it's that it's called post because there's a synapse in the prevertebral,
The chain
paravertebral rather.
synthetic chain ganglia, aka
Yes.
paravertebral, right? Is that synonymous? Synthetic chain ganglion, paravertebral synonymous. Same thing.
Yeah,
Synthetic trunk.
ganglion of sympathetic chain. So sympathetic chain. Yeah. So it fires in there, and so it's splanchnic nerve is considered post. I think that's as much as we need to know.
Post, except for
It's just confusing because they all have a post ganglion.
Okay,
Or
I'm
they all have a
ready.
pre-ganglion. It's just the only difference is where it's synapses, but I don't know why that was considered post instead of pre.
Say it one more time.
Like they all the stuff that uses a splanchnic, they all have both a pre and a post. So I don't know why, like.
Yeah, but the
might be
location I
cardiopulmonary.
think matters.
So I guess it's just the location that determines post, but I don't know why it would be, I don't know why that would be considered post. Like why would the other one be considered post?
Because
right. That's what I'm getting.
because look, there's another ganglion.
But this is the second ganglion, it doesn't synapse there.
Right.
So
So-
it still has only two. You know, it has
Right, right. But
two fibers.
right. And so since it doesn't fire there, it's considered a
Yeah, but
a
why
pre.
when what I'm confused on is this is pre, this is post.
Yeah.
But why is it considered post? Because this is pre, this is post.
Yeah, like you would
Why
think,
is that
why isn't
considered
this
pre?
considered? Yeah, I see what you're saying. I
Well,
don't know.
these aren't firing to one another. That's not a synapse.
No, I know, this
I mean,
is,
it's synapsing with the adrenal gland, but
This
then
is
it's
a synapse.
synapsing back. I don't want to go like this.
there's
Is
no synapse in there,
there's no synapse? I don't see any synapse in there.
only in that ganglion.
Right.
I don't know, these were the only, those two were the only two exceptions for like the stuff that he's been teaching us.
Yeah, I mean,
I'm just
It-
confused about
it
the
doesn't
name, like,
sh-
I understand the process completely. I
it
just don't
doesn't
know why
show-
it's considered
in this picture, there's no post. In these with these nerves, they're
Yeah,
both pre.
well,
They're actually both pre. Just noticing that.
oh yeah, it's not synapse. But that's not a good picture,
There's a
because
post
Whereas
one, there's a
here-
post one.
Where you see the Y and the dot, and
yeah, that was
that's
like the only exception to the,
we got two Y's there.
My stomach's rumbling. I'm gonna go eat, get dressed, do this PD examination.
Yeah.
Yeah. And I have to write on food. TBJ.
look good.
I was like nauseous hungry. I know. I'm just gonna go change and then if you want to practice. Yeah, I'm not allowed. Yeah, I've been trying to get it. I just took it all out and tried it. Or took it all out and left it in the bag. Yeah. I guess they're gonna switch us off like to another. That way it's more fair. We get them on lunch and stay till the end of the day. Yeah. Well, I'm gonna try and be really productive. Try. No, for sure. Still make me start. Oh, I definitely better start here. Oh, really? Where's that one? Who doesn't like cheese sticks?
Well, no, I didn't have a lunch, so, because I haven't gone grocery shopping. So that's that.
What happened?
She just did.
Trying to review everything before the contract.
What's your next lecture? Is it?
It's not that bad.
Next week.
Wednesday?
I think it's Tuesday.
Tuesday?
I should probably start looking at tackling.
Probably.
What's next
Friday.
Next Friday?
Yeah.
I'll place her looking at accent on.
After the test Monday. You want to do a minute and then?
I don't wanna like look at it now, cause I feel like I'll forget.
I know, that's all I'm like.
good because I was studying the skull and all that. The skull, the meninges, and the pterygoid processes and all that stuff, and that's on it. So it kind of comes hand in hand. So it's like not gonna be awful. I heard his quizzes are not like ridiculous. If you ask pick and choose, pick the ones that are on the anatomy test, and so that you've got reinforcement. Were you saying what to the reinforcement?
Yeah, what did you say? What did you say? Thank you. What did you just say?
Reinforcement.
I did not say that. Yes, it was. Like, it just happened.
I said it.
Sure.
The one. Said. Jump.
What?
Jump.
Oh, God, not that one. You're out of control.
Yeah, so I said, you go to the stuff that's relevant to your local anatomy. So you look over meninges and actually a rehabilitation with studying both at the same time. Yeah. So you reinforce it. What you already know from anatomy class. Right. But you can write it from lab.
Smart.
And so back to reinforce.
All right. I like it. Don't like that. Piss me off.
Not fond of them either. Soggy sandwiches.
Yeah, we're weird. Really weird.
Medium iced coffee, cream sugar.
Medium iced coffee, cream sugar.
Yes.
Check. I'll do that. I need to help them, so no one's really helping me, so I don't know what happened. Because I'm like looking up this stuff. You know what I mean? Yeah. So I've been looking. I feel like I'm accomplished in there, but I haven't like. I need to break the card. Maybe help them with my own. But it's just nice to have someone like. Yeah. I like that. Huh? That's the only reason I like Bob so much. Because he just knows it so well. Yeah. So if I say it wrong, it's like, no, it's this. Oh, okay. But then when someone's like, oh, I think it's, I'm like, okay, I don't know. Yeah.
Yes. So,
So like Alex was here last night, and he made like the roll eyes really simple. Like, yeah, he like, he was a good person too. He like this. Like, this is what you need to know. I'm like, oh, okay. Yeah. So it's like the percentage of body. So it's 9% on the front, 9% on the back of the legs. So 18. The arms are each 9. The front's 9, the back's 9.
synapses at the chain.
But probably 9. Or 18.
Does that one actually go in?
That's it. Oh, and then it's either 9 or 18.
Blank here?
So everything's 9.
The one that can go in two or in is associated, but it happens second one, where
But I'm not going to work in
the other
the
one,
hotel
they all
by myself.
just bypass. Around the village, it just passes through and connects to the prevertebral. Yeah, but that's your, like, so that's just under the, basically breaks down to be all the ones that go to the prevertebral are preganglionic, and all the ones that, the one that doesn't. Like, it makes like, yeah, the name itself doesn't make sense because they both have.
What's up, basic? How you doing?
How am I basic? I'm far from basic, okay?
Okay, excuse me, sorry.
With your basic Tom, well, the only way I rationalize
Like every white girl has a pair of those.
that.
Well, I ain't no white girl, so.
No, it's quite basic.
How does that make me basic?
And they don't have to
Good.
go
I like lean back. Alright, I'm gonna go home here.
Thank God.
Take your time. It was free to get lost.
No, I'm gonna go.
Yeah, I was gonna go.
No, I didn't. For all the classes, or with the actually they all classes. Because it was for a medical reason. Mostly counting our medical reason for the last time we left. Who's here?
Sorry. I'm just gonna own it. I mean,
Just own it. Kill the swag. Kill it. You feel like in there, basic workout.
I thought you were just gonna unbuckle your belt right there. I didn't notice. I didn't see your little flip thing. You're just like, okay, like I, you know, do what you gotta do, but sure. like the whole greater and lesser least. This to this, or this to this, or this to this. Three different things that got this.
Oh, no, I keep thinking it's mine. It's like, but nobody loves it. Oh, no, I just think it's mine, so I keep looking down.
I hate stones. That's the first time I think I've ever seen you like do this. Yeah. Like you might doing something over here. In the first lap. Yeah.
Even when you guys, like when we do our morning lab, like we get like a little hour and a half like break in between.
Yeah, showers.
We were wondering if you remember. That's why I was like, oh, it's like Converse, like.
I left the same time I leave every day. I leave it. I'm not lying. I hit every single light. I've never done that. Every single light from freaking Davis Road to
Oh,
to
yeah.
school. Every single time. I'm just like,
You do Cypress or?
what?
You do Cypress? Where do you live?
I even put the one red light on 6
41 and Cypress Lake. It turns into like Daniel's and Cypress Lake. Yeah. Yeah. I live right there. Probably the same place. I keep forgetting what that little fucking road is called. But yeah, you know the two churches?
Yeah.
And there's like that little cutaway in that turns into condos.
Yeah.
I live right there.
Wait, if you're heading towards the
Right. Right across from the alley.
okay, yeah.
I stole your stuff.
You want
That's
the,
okay.
I'm like,
Oh, she was just right here?
Yeah. That's probably why you're running late sometimes.
No.
I get about every single one. I get the one like on 41. I get the Summerlin one every single time around the house. There's also help that I've learned that like 7 times. And then orthopedic stuff is kind of like.
This is your thing. That's my thing.
It's hard to tell. It's my work. Like I work at the hospital, so I had to be there at 6. I left at 5 o'clock. I ran the red light since I'm the only one out there. So I don't know like the morning traffic like how bad it is. I know I've been late for meetings because when I
Traffic is awful.
yeah, it's bad.
My buddy says it takes like 10 minutes longer than
From October.
Where are you going? I don't know. I need to eat.
Not necessarily, not the morning.
Oh,
But
you
like,
did, where did you just
like,
go?
if you were to go
We
Cypress
wanted to
Lake,
practice really
like
quick.
if we got
So,
out of Lock from Cypress Lake to Daniels,
I
to
did
get
that.
to Lakeville,
I don't know where I'm going. Well, if you guys are gonna go over
maybe
anatomy
he left 6
or physiology, let me know.
to get to your
Okay.
place, like
Oh, like
later,
now? Yeah. Okay, do that now.
in season at 5. So.
I don't even know where everyone is. Well, if you find Bob, because I need him. Yeah, I don't know where. I'll let you know though. Okay, thank you.
But there's quicker ways, like going all the way down. Like during season, I'll probably do Colonial to Metro, and then dodge it. It'll take you to Daniels.
$1.
You can do the same way. I don't know if it would be in the morning because it's all commercial.
I just don't have a 3x5
It's like
car.
commercial here. There's a nice little deli, but that's about it.
I just need one. I'll even give it to you afterwards.
See, right?
No, I don't want it.
I gotta do that.
Why is there nothing on? Why is there nothing on? I've never heard anything. What time is it? I might have walked past. We'll have to try it another time. But I never hear anything from your side. We're pretty quiet. Like, we don't have dogs. Yeah, that dog. Oh, yeah.
All right, I'm gonna study a little. Okay.
I know, I don't know why I think that would be one thing. Just because I know I'm going to be like breathing all the time. I didn't plan. Oh my god, your combo was so good. And I felt like it was not good. No, it was good. It was really good. We ate